How's it going today, everybody? Israel Thompson back again with another assessment video. This time we are assessing the neurological systems. We are assessing the mental status and the cranial nerves. So mental status is kind of a complex subject. So to assess that, we came up with a bunch of different questions that you can ask and things of that nature to kind of gauge to see how the person, your patient or your client is doing mentally. So first you will come up, you introduce yourself like always. Hi, how you doing? I'm Israel Thompson.
Hi.
And I'll be your nurse today, okay?
Hello.
All right. Well, first thing that you want to do is while you're doing your assessment, you want to pay attention to their body language, how they're sitting, personal hygiene, anything that you could just see out of the ordinary that might indicate something is wrong. Pay attention to pretty much the whole total package, body posture, everything. All right. Then you can assess their mental status. You can ask them some questions to attain their level of consciousness. So you can ask them for their name, time, place, things of that nature. So do you know where you are, sir?
My house.
Of course. And what's the date today?
The 3rd.
You can't look at your watch. That's cheating. All right. And can you state your name?
Gorgeous man. 2 N's.
Alrighty. And I'll give him another one. And what is your date of birth?
01/01/81.
Alrighty. Now to further attain his mental status or assess his mental status, you can ask him a couple of different analogies. A dog is to a puppy as a cat is to a
Kitten.
Yes, sir. Things of that nature, riddles. There's some other tests you could have them perform. There's one test where you could get them to write a dictated phrase. So off the top of my head, write Longhorn Steakhouse. And with these tests, these mental tests here, you want to make sure that the patient can do them with ease, without any, pretty much without any struggle. Right? Thank you, my good sir. What's another good test? You want to make sure that you test their memory. So I have a couple of items here in my pocket. So I'm gonna set that down here. And then in a couple of minutes, you want to come back to those and ask the patient to describe the objects you got there. So I'm gonna ask you, what objects did I put out there for you? Not now, but later on in the assessment, okay?
Oh, okay.
So I'm gonna take that up there. So that's gonna test his recent memory. We're also gonna ask him about verifiable past events that can help assess his mental cognition. You can ask him, what is your mother's maiden name?
Oh, you're like
Yes. What is your mother's maiden name?
Jones.
All right, cool. And you could want to assess judgment as well. So ask morality questions. So let's say a friend of yours has lost $1, and you're walking into your friend's room, and then you find $1 on the ground. What do you do?
Ask him if it's his dollar.
Okay.
Give him his dollar back.
All right. And you want to make sure that their answers are reasonable. All right. And there are some other questions that you can ask. You want to try to assess their emotional stability. So ask, hey, how are you feeling right now? You know, things of that nature, you know, to try to guess and gauge their emotional status as well. All right. Now, usually you're supposed to wait about 10 minutes for your recent memory test, but I'm gonna go ahead and ask them now before we get on with our next topic. So, do you remember what 3 items I put before you, sir?
It was a pen, light, thingy, quarter, and a Q-tip.
Alrighty. So now we're going to move on to assessing the cranial nerves. So we're going to start at the first one, the first cranial nerve, which is the olfactory nerve, which is in the nose there. So first I'm gonna plug one of your nostrils, and I'm gonna just see if you can breathe. Okay? Can you breathe out of this nose? All right, and this one. All right. Now to assess this nerve, you would plug one nostril and then wave a fragrance on the other side and have the patient guess to see what fragrance that is. So I have one here for me. So I'm gonna plug this one up, and then I'm gonna have you smell this one, okay? Right.
Mouthwash?
Yes, sir, that it is. And then plug the other one. I'm gonna have you smell this.
This was like a candle or like a.
Oh, yeah. Plug in. Good enough.
We'll plug in.
All right, now you want to check the second cranial nerve, which is the optic nerve. And how you would do this is by the Snelling test, which tests distance vision, and you'll also test the I can't pronounce this word, Rosenbaum test, which is tests near vision. Nearsightedness is the Rosenbaum. Farsighted is Snelling. All right, now I happen not to have one of those here, so we're going to keep it pushing. All right, now you want to check the visual fields. So you could do this by having the patient cover one of your eyes there, and then I'm gonna cover one of my eyes, and then my peripheral vision should align with his peripheral vision. So I'm gonna take my hand and I'm gonna reach it out here, and you tell me when you see my 2 fingers wiggling in your peripheral vision.
Yes.
See? All right.
Yeah. Yeah.
All right. And we're going to try the other eye.
Yes.
All right.
Yeah.
All righty. Now you want to check the eye, the muscles in the eye. You also want to check cranial nerve 3, 4, and 6. So just like we did in our other assessment video, we're going to check the eyes to make sure that the eyes are round, equal, reactive to light, and accommodating. So if you have a trusty pen light here, if you look straight and try not to look at the light there, you want to shine the light in there, make sure those pupils are dilating there. You also want to check their check the cardinal vision, the muscles in the eye there. So you'll just look right here at this pin. Don't move your head. Just follow it with your eyes. Make sure the eyes aren't shaking or jerking. Everything is fluent and smooth. All right. Ooh, one second. And then you want to test the face sensations. Where's my pen? Another dull sharp test. So I'm gonna use my trusty pencil here, and you just close your eyes for me, sir, and then just tell me if the sensation you feel is dull or sharp. All right.
Sharp. 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 Dull. Sharp. Dull. Sharp. My pencil. It's cold. That's all I can feel. Dull.
All right. So with that, and you also want to check the corneal reflex. So with this, you will get your cotton swab or your cotton piece, and you would just touch. You would just open your eyes, sir. You just lightly touch cornea there, and both of the eyes should blink at the same time. I'm not going to do it, but that's it doesn't hurt. All right, next. You will check the facial nerve and the glossopharyngeal nerve. So this one here, you will have the patient pretty much just make faces at you. So first, not like that. Can you extend your eyebrows here and wrinkle your forehead there? All right, you can stop that. Now smile, but don't show any teeth. All right, can you puff out your cheeks? And then just purse your lips like you're about to whistle. All right. Now you'll also check for taste. So if you have like certain solutions that were sweet or sour or salty and stuff, you would give that to the patient and have them stick out your tongue and just dab it on their tongue, and then let them tell you what they taste there. Now the next one will be the acoustic test, and what you would do is you would have the patient cover one ear, so you would cover that one ear, and then I'm gonna whisper a phrase to you, and then you repeat back what I say, okay?
Mm-hmm.
All right.
Apples and oranges?
Yes, sir. All right, and then the next one.
Batman, Superman.
Yes, sir. After the acoustic test, you want to check the vagus nerve. So, yeah, the vagus nerve. So that's inside the mouth. You want to check the soft palate. You want to check the uvula and make sure it's midline. And you will also check the gag reflex while you're back there. But since I don't have a tongue blade, I won't be that good
because I just ate.
All right. So now I will move on to cranial nerve 11. Oh, the vagus nerve, that would be cranial nerve 10. So now I'm on to cranial nerve 11. So we want to check the muscles around the neck area, all right? So with my hands on his shoulders, just shrug your shoulders. With my resistance there, keep them up. Keep them up. All right, you want to make sure that that the tension is there, that they give force, the same amount of force on each side, all right? And then turn your head to the left, and then I'm gonna push my hand against your face there. All right, now the same thing on the right. All righty. And then, the hypoglossal nerve. All right, and this one is usually you check this while you're checking the mouth, but since it's the last nerve, it's nerve 12 out of 12. We're just gonna say it's the last. So this one, you're just really much checking the movement of the tongue. So can you stick your tongue out at me? Can you point it up to your nose? Point it down to your chin. Push it inside your cheek there, and then you want to check to see if there's pressure there. And then the other side, check to see if there's pressure there. All right, and again, you would talk to your patient, make sure they have no kind of lisps or any type of atrophy with any of the muscles that you're working with or covering during